Hello, everybody. This is Chaplain Kelley, and today I want to talk to you about the value of EMDR in a very quick video summary brief form. Now, EMDR is eye movement desensitization and reprocessing. It is a way for a therapist to go and help a client through their traumatic memories and compounded trauma to be able to find healing and wholeness in that. And I've had many clients say that at first the memory or the traumatic event was in front, and now it's somehow back, more of a distant memory. Now, the memory never leaves you, but it just kind of releases that emotional power. It releases that emotional state that is surrounded by it. Now, when we experience trauma, a lot of times what happens is our neural net freezes. And in that freeze process, it wraps around the sights, the smells, the emotions in that memory event. For a U.S. soldier, for example, and they are blown up in an IED, and that traumatic memory is there, they might be able to smell the burning flesh and be able to smell the explosive powder, might be able to smell and experience all over again what happened. And so the right trigger, the right moment can take them back. For an example, for myself, when I returned back from Afghanistan, immediately I was thrust into a program called Clinical Pastoral Education, which is where I was trained to be a hospital chaplain. Now, one of my first patients to visit was someone returning back from Afghanistan. And that soldier had the smell of Afghanistan on them, the dust on their uniform, and I could smell it. And it brought back those memories, and I relived it all over again, and I could not minister to that patient. I had to leave and seek immediate supervision. Why? Because that traumatic memory of being in Afghanistan was relived in my psyche until I was able to seek help. And so EMDR is a way for your brain to process through that traumatic memory. Now, it could be a car wreck. It could be something from childhood. It could be anything that you deem as traumatic within your life. For example, if someone has a car wreck and then later in life, through years down the road, they end up having anxiety about other people driving and they're not in control, and they feel that they're losing control, and they feel that they're going to crash at any moment, and they're kind of reliving it. That is a case for when EMDR can be very effective. Now, EMDR is bilateral stimulation of both right and left side of your brain. It was originally created by Francine Shapiro, who thought in that moment when she created it of a traumatic event as she was walking through a park, and as she darted her eyes back and forth, she was able to have some relief. And that's what the basis of EMDR is. If you follow your eyes with my fingers back and forth, as you're thinking about the traumatic memory, there is going to be something in your brain that helps dislodge that traumatic event to where it's not as potent. It's not as effective as it once used to be. Now, this is not Jedi mind trick where it's going to erase your memory. No, that's not what it is. But what it does is it helps you process through that bilateral stimulation in your memory to be able to let your brain heal from it. Now, I personally choose, I don't really do the finger exercise, but what I do use is this. It is called a tapper. Now, it comes with a tapper machine and paddles. And the client will hold each paddle right and left side, and it'll buzz, alternating buzzing, and it does the same effect. It alternates right and left side of your brain. That helps dislodge that memory. And as you go through the 8-step process and the AIP process to be able to help a client through not only the memory, but what is attached to that memory. And that is usually a negative cognition, like I am not good enough. I am helpless. I am responsible. I am worthless. All these negative cognitions are stuck in your brain along with those traumatic events. And therefore, this helps you process through that and choose an alternate cognitive thought pattern, meaning that once you thought you were worthless, and now you are you are worth something. I may be not good enough, but now I am good enough regardless. See, it changes your thought pattern. And it, along with that negative cognition, turns into a positive cognition. So EMDR can be very, very effective with clients undergoing traumatic memories. And there can be a lot said about not only just what we might call minor T traumatic events, but also complex trauma, maybe stuff from childhood. If a 3-year-old child has been abused and sexually molested by an adult within the family, such as I've had before in clients, is with family members who have, like mother or father, who've molested and sexually raped a little 3-year-old child. How's that 3-year-old child going to cope? They're going to not only internalize that trauma, but they could split and dissociate from that trauma to where it might affect them later in life. But right now, it's helping them to cope with all what's going on at the moment. And so EMDR is very effective to help those clients too on that spectrum of dissociation, whether it be from minor dissociation all the way up to DID, which is dissociative identity disorder. So I hope this kind of clarifies just a little bit, a brief summary of what EMDR is and does, and as we as Army chaplains, especially the Family Life Chaplains, can help you through your traumatic events, whether it be from combat or everyday life. We are here to help you. May God bless you and take care of you. I hope you like and subscribe to this video, and I pray that God's blessing be upon you today.